5 science-backed health benefits of CBD oil. Cannabidiol or CBD is a chemical compound found in the cannabis sativa plant. When applied topically or consumed through smoke inhalation or edible consumption, CBD interacts with neuroreceptors in your endocannabinoid system, which sends signals between your cells to help regulate your movement, mood, homeostasis, and immune system. CBD is often contracted from the cannabis sativa plant in oil form and mixed with an inert carrier oil like hemp seed oil for consumption. In fact, of the 60% of the US adults who report having used CBD before, 55% of them use CBD oils and tinctures specifically, according to the recent Forbes Health survey of 2,000 US adults conducted by one poll. 5 benefits. Number 1. Offset anxiety and depression. CBD's ability to calm is perhaps its most popular effect, and the reason its use is so widespread. A 2017 study in the Brazilian Journal of Psychiatry tested the anxiety levels of 57 men in a simulated public speaking test. Some received a placebo while others received either 150 mg, 300 mg or 600 mg of CBD before their speeches. Those who received 300 mg of CBD experienced significantly reduced anxiety during the test compared to those who received the placebo. Interestingly, participants who received either 150 or 600 mg of CBD experienced more anxiety during the test than the 300 mg group. Meanwhile, at least one study in mice revealed CBD had effects similar to the antidepressants imipramine. Human trials are needed, though, to confirm whether CBD can induce this same antidepressant reaction in our bodies. Number 2. Treat select epilepsy syndromes. In some instances, CBD can be used to treat epileptic seizures. In 2018, the Food and Drug Administration (FDA) approved the use of CBD under the brand name Epidiolex to treat seizures resulting from Lennox-Gastaut syndrome and Dravet syndrome, 2 rare forms of epilepsy, in patients at least 2 years old. 3 well-vetted studies provide the basis of support for the FDA's decision. In these trials, 516 patients with Lennox-Gastaut syndrome or Dravet syndrome received either Epidiolex or a placebo. Epidiolex, when taken along with other prescribed medications, decreased the frequency of participant seizures compared to the placebo. Number 3. Reduce PTSD symptoms. In a small 2018 study in the Journal of Alternative and Complementary Medicine, 11 people with post-traumatic stress disorder (PTSD) received CBD along with routine psychiatric care for 8 weeks in an outpatient psychiatric clinic. 10 of the 11 experienced a decrease in their PTSD symptoms. CBD was generally well tolerated, the researchers write. Margaret Rajnik, a doctor nursing practice experienced in medical cannabis and CBD, emphasizes the importance of using therapy in tandem with any type of cannabis or CBD for PTSD. There's an amount of therapy that is needed for PTSD, she says, but CBD will give you that little bit of decreased anxiety. 4 other human trials from 2012 to 2016 suggest CBD reduces PTSD symptoms, although some include THC or tetrahydrocannabinol, the main mind-altering element in cannabis. When THC and CBD work together, they create what's called an entourage effect, complementing each other's benefit and potency. For example, taking the same dose of THC and CBD together tempers the high from THC, while just a little THC paired with more CBD enhances the effect of CBD. Number 4. Treat opioid addiction. Some studies, both preclinical animal and human clinical trials, suggest CBD could be used to help treat people who are dependent on opioids. In one such study, researchers administered CBD to people with heroin use disorder. Over the course of a week, CBD significantly reduced heroin users' cue-induced cravings, withdrawal anxiety, resting heart rate, and salivary cortisol levels. No serious side effects were found. Other studies found CBD helpful in reducing various psychiatric and medical symptoms like anxiety, insomnia, and pain in patients with substance use disorder, indicating that CBD may be an effective treatment for opioid addiction. However, further studies are necessary. Number 5. Alleviate ALS symptoms. Amyotrophic lateral sclerosis, ALS, is a disease that causes nerve cells in the brain and spinal cord to deteriorate, resulting in loss of muscle control that worsens over time. It is not yet understood exactly why ALS occurs, although it can be hereditary in some cases. There is no known cure, and there are only 2 FDA-approved medications to help treat ALS symptoms. Research suggests people with ALS can benefit from the entourage effects created by the combination of THC and CBD, similar to people with PTSD. In a 2019 study, patients received a combination of THC and CBD in varying studies depending on their needs and preferences. Those with mild, moderate, or severe spasticity, muscle tightness and stiffness due to ALS reported high levels of satisfaction with the treatment, and those with moderate to severe spasticity reported higher satisfaction rates than those with mild spasticity.